Hi, Dr. Becky here with Del Mar Center for Behavioral Health with another short video. Today I want to talk about functional communication. Functional communication is, to really break the term down, means when we engage in communication for a specific function or reason. And if you have watched one of our other videos, we talk about what are the functions of behavior. And there's those 4 functions of behavior, and they spell SEAT. So sensory, E is escape, A is attention, and T is tangible or an item. So we want to today build on that and talk about how we can use communication to be functional. The challenge with functional communication, or the reason it comes up oftentimes in treatment, is because maybe a child is engaging in something that's a less desired behavior to get one of those functions. And so what we want to do is give them an appropriate or functional way to communicate that that desire, that need in a more appropriate way. Using communication. So it's sort of easy to think about when we're talking about functional communication for a kiddo maybe who doesn't have any language or maybe even any kind of communication. So we want to give them a way to communicate, whether it's vocal verbal language, maybe it's sign, right? Or maybe it's a picture card. But for our kids who are verbal or have communication, we also target functional communication as a goal, because even kids who have language, when they get upset or really disappointed or frustrated or feeling any of those big emotions, oftentimes their verbal communication or whatever their communication skill is goes down. And we see kind of reverting or going to using behaviors to make their communication wants or needs known. And so we want to give them a different way to do that. So functional communication is not just for kids who don't have a way of communicating. It can also be for kids who have communication, and when they're experiencing those really big emotions, they're reverting to using a behavior that's often less desirable to make their communicative needs known. So for functional communication, remember, we are giving a child an appropriate way to communicate their wants and needs. And there's really a couple different things we want to keep in mind when we're teaching or targeting functional communication. The first is that it has to communicate in some way what the child wants. So if the child is having a tantrum when you say no, or when they are needing a break because they've worked for a while and they're fatigued, they're throwing a tantrum, we want to give them a different way to tell us that they're fatigued and tired and need a break. Maybe it's a break, right? A sign. Maybe it's a break card that they hand you. Some of our kids, we've come up with code words. I had a little gal that wanted to say rainbow sprinkles, right? And that was her way of requesting a break. And you might say, well, gosh, Dr. Becca, rainbow sprinkles has a ton of syllables, and that is not easy to say, right? But it takes less effort than throwing a tantrum. And that's one of the things that's important, is whatever we're going to be encouraging or having the child use instead of the behavior we don't want to see. So in this example, it's the tantrum. We want to make sure that that functional communication uses less effort and energy than what they're currently doing. You might be thinking, well, why? Otherwise, they're not going to do it, right? What they're doing is working really well for them. And so if we want them to do something different, we have to give them something specific to do instead and teach them how to use that. And we also need to make sure that it takes less energy and effort than what they're currently doing. So let's say it's, again, break or handing a break card. This could be for verbal kids too, guys. This is not just for our kids who don't have language. Because remember, when we're thinking about our kids with, whether it's autism spectrum disorder, ADHD, oppositional defiant disorder, to trauma, Those are areas or sort of have symptoms that are related to that frontal lobe having some trouble working, right? Or maybe even the language impairment is part of the diagnostic criteria. So they're going to have trouble with language, or they're going to have trouble doing those higher level skills like language or generating ideas and communicating them appropriately when they're feeling a lot of emotions. So we need them to do something different than what they're already doing. We have to give them what it is that we want them to do. We have to make sure that whatever that replacement behavior is, whatever that functional communication is, takes less energy and effort than what they're currently doing. And tantrums actually take a lot of energy and effort, so we can be pretty safe in picking something other than that. We also want to be sure that in the beginning, as soon as they use that new type of functional communication, we reinforce it immediately. So as soon as the child says break, they get a break right away, immediately. And that teaches them that this works for communication. Because remember, up until now, what's worked for them has been that tantrum or screaming or hitting or whatever it is that they're doing to communicate their need. Remember in our example of our kiddo has worked for a long time and they're pretty fatigued. Whatever they've been doing up until now has worked. And so we need to show them that this new thing, that's going to work. So break or handing a card, immediately the task demand stops and we stop. Also, in the beginning, we want to be sure that every time they use it, it works. So what happens is when the kiddo learns that this works, they're going to start doing that more often because breaks aren't great. And we need to reinforce that in the beginning, every time, because again, they have to learn that this new way of communicating is effective and gets them what they want. Then once they're using it consistently and the child knows that this works, then we can start talking about shaping, right, or slightly changing that behavior so that maybe not every time you ask for a break, you get one. But when you ask for it, we can tell you first this, then a break, or in 2 minutes, then a break. We can start kind of delaying the amount of time for them to get the break to a more socially appropriate time. And they're still learning that that break gets them heard. Asking for this or using whatever that functional communication is gets them what they want and that we're hearing what they want. So just a brief recap of functional communication. Functional communication is when we are teaching an individual to communicate their wants or needs in a way that is more functional, more desired, more appropriate maybe than what they're currently using. We want to be sure that whatever the new way of communicating is going to require less effort than what they're currently doing. We want to be sure that every time they make that request or every time they use the functional communication, it's reinforced, particularly in the beginning. They have to learn that it's powerful and that it works. We want to be sure that it's less effort, that it works every time, and that it works quickly. Otherwise, we're going to see reverting back to the other behaviors. Also, a reminder that functional communication is not just for our kids who don't have vocal verbal speech. Functional communication can refer to giving a child a way to communicate if they don't yet have it, but it also can be for our kids who have language and struggle to use it when they're feeling really overpowered by those big emotions. So again, I'm Dr. Becca. I hope this short video was helpful. Have a great rest of your day.